hepatitis is inflammation of the liver, and this is caused by a virus known as the hepatitis B virus. One may wonder, how do I acquire, or how does one acquire hepatitis B? And by and large, when you take Ghana, it is a place where hepatitis B is hyperendemic, meaning that most of our people carry hepatitis B, ranging from 8 to 15% depending on the population type. Now, when it comes to transmission, our main mode is a mother having it and passing it on to the child during pregnancy, during labor as well, what we call mother-to-child transmission. There are other ways we call horizontal transmission, where household contact, sharing some personal things like toothbrush, like razor blades, etc., can lead to hepatitis B infection. Sometimes also, the barbering shops, the machines they use, if they are not well sterilized, when you go for your pedicure, if these ones are also not sterilized, you stand a risk of getting the infection. Now, sexual transmission, yes, can also lead to that. And it's also very common in IV drug users. They jab themselves and pass the same needle to another person. One of the things we need to take care of is that anytime there is blood exchange, then there's a risk of one acquiring the infection. Now, hepatitis B can present in two ways. Acute form, where the person may feel sick, the person may have jaundice, the person may be sick, may be lethargic, sometimes they may be vomiting as well. Whereas with the chronic ones, it can be with the person, without the person even knowing he or she has hepatitis B. Most of the time, the ones acquired from mother to child, they tend to not to have any symptoms at all. And then they only get to find out when complication has resulted. Now, the other thing we ask ourselves is that when I have hepatitis B, what do I do? Speak to a health worker. We will take a history, we will examine you, we will come up with a diagnosis. Although hepatitis B is not a curable disease, it is manageable. And we do the labs to know the amount of virus in the blood. Knowing the amount of virus in the blood will tell us whether one requires treatment or not. The other thing is that we do the liver function test. That also gives us an idea of what is going on in your system. Abdominal ultrasound scan to pick up any complications that may have arisen as a result of the infection. And there are drugs available for treatment, and these drugs are relatively affordable. Looking at the complications, if you look at the cost of complication and the cost of treatment, then the cost of treatment is way better. And therefore, we need to seek care if we have hepatitis. And hepatitis care is not far from you. There are lots of places, I tell you, Korle Bu has the best. And anytime you come, we have a special clinic we run for people with viral hepatitis on Tuesdays. We take your labs, we make sure we have what we call the private services, and then we even have our clinics where you have the expertise there to help. Thank you very much. Wishing you all the best on World Hepatitis Day.